Healthcare systems and hospitals are freaking out.
That's a good way of putting it. They are freaking out because about 40% of hospitals in the United States are already operating at a loss. This is especially true in rural areas and for safety net hospitals. And if you start shrinking Medicaid, many hospitals could close.
As a pediatrician, as someone who works in a pediatric hospital, I'm worried about what this means for children's hospitals. I work at a standalone children's hospital. The majority of our revenue comes from Medicaid, as the majority of children in America have public insurance or no insurance. If you're reducing the amount of children that have public insurance, you're just significantly decreasing the revenue when our hospital is already having negative margins every year.
At the same time that you're hurting rural hospitals, safety net hospitals, and pediatric hospitals like where Alicia works, it's expected that the hospitals that are going to do the best here, for-profit hospital chains,
Which are hospitals that are required to prioritize cost over care.
but I thought this administration was tackling these conflicts of interest in healthcare.
By having not-for-profit hospitals suffer.
So, yeah, people would be freer to make decisions about what they want their health insurance to cover. But the reality in public health is that these changes overall are going to cause people to lose coverage, get denied care, and receive larger bills.
In fact, the Congressional Budget Office estimates that if this bill is passed, about 16 million people in the United States would lose health insurance.
16 million.
That's about 8 million from the changes in Medicaid, and about another 8 million in changes from the ACA marketplace and from the tax credits.
This is devastating that we would see this rise in uninsurance rates across the country after a decade of steady declines. And it's expected that children, parents, and low-income families are going to be the hardest hit.
This is just a huge rollback of all the progress that we've made in the past 15 years.
And it's moving so fast that people are not even having time to read the bill and anticipate the changes before voting.
Getting the bill text, we got it within a 72-hour window before voting on the bill. The issue is not about Marjorie Taylor Greene didn't read one small section on page 248 out of 1,100 pages. A clause that is in the One Big Beautiful Bill would take away state rights to make laws or regulate AI for 10 years.
A line in a new bill could drastically change our federal government's system of checks and balances. And a Nebraska congressman says he didn't even read it before he voted on it.
I am not going to hide the truth. This provision was unknown to me when I voted for that bill. You didn't even read it?
Alicia, is there anything in this bill that could be good for healthcare?
I mean, potentially.
Give me something here.
There are sections in this bill about improving price transparency in hospitals, about repayments for telehealth, and about prioritizing innovation. But
that sounds good.
They're kind of like double-edged swords.
Yeah.
So one of the good things about price transparency is that the goal is to ban pharmacy benefit managers, things like CVS Caremark, from, quote, spread pricing. They're also pushing for more hospital transparency, having more listing of pricing so that you know what you're going to be charged and you don't have a surprise bill, which would be amazing. No one likes getting a surprise bill in the mail.
And then the fast tracking of medical innovation does sound good. But in order to fast track, you have to loosen some of the regulations. So, for example, experts are saying that loosening FDA requirements in order to allow fast tracking of medical innovation could reduce safety, where the FDA would be reviewing less robust evidence on shorter timelines, and that this speed over careful scrutiny could really harm safety.
And yet vaccines that have decades of evidence.
No fast tracking. No.
No.
It's only for these wearables, right? We got to fast track that.